Do you know the strongest parts in human body? It's enamel of teeth and osteoid of bone. Why? Because of calcium in these parts. So calcium provides hardness to these parts. So have you ever thought, what if calcium get deposited in other organs of human body? So that organs will become hard, rigid and inelastic. It's abnormal and it's called pathologic calcification. Pathologic calcification, as I have taught you, that normally calcium salts are normal constituents of bone and teeth. So calcium is normally present in osteoid of bone and enamel of teeth. That provides hardness to bone and teeth. So you can see here the teeth and the bone. Calcium is normally present in them for providing hardness and rigidity. So majority of the calcium in human body is present in bone and teeth in the form of the salts. Only 1% or less than 1% of the calcium is active and is present in ionic form in the blood. So what is pathologic calcification? The pathological calcification is deposition of calcium salt in the body other than osteoid or enamel. So except the osteoid of bone and enamel of teeth, if calcium is deposited in any part of human body, it is known as pathological calcification or heterotropic calcification, and it is abnormal. So abnormal deposition of the calcium salt along with small amount of iron, magnesium and mineral salts in the cell, that is known as pathologic calcification. That is the definition of pathologic calcification. Now what are the types of pathological calcification? There are two types of pathological calcification. It is known as dystrophic and metastatic. So let's discuss these types. In this diagram, in this page, you can see the differences between dystrophic and metastatic calcification. So the basic difference is that in dystrophic calcification, the calcium is deposited in dead and dying tissue, dead, degenerated and dying tissue. But here in blood, normal calcium metabolism and normal calcium levels in the blood is present. But on the contrary, in metastatic calcification, the calcium deposition occurs not in dead and degenerated tissue. It occurs in normal tissue. It occurs in normal, healthy, live tissue. But here in the blood, the calcium metabolism is deranged. And in the blood, there is hypercalcemia. This is the biggest difference in them. Generally, dystrophic one is irreversible because it is occurring in dead and degenerated tissue. But the metastatic one can be reversible if we correct the metabolic disorder which is leading to hypercalcemia in the patient. So this is the biggest difference between them. I would like to draw a diagram for you to explain you the two types of calcification. So here I would like to draw dystrophic calcification and here metastatic calcification. So let's draw a tissue. So this is a tissue here and let's draw a tissue in metastatic also. So this is the tissue for metastatic. I am drawing the blood vessel in both of them. So you can see blood vessel in both of them. So in the blood vessel, in dystrophic calcification, the calcium levels are normal. But in metastatic calcification, the calcium levels, there is deranged calcium metabolism. So patients have hypercalcemia in metastatic calcification. What about the tissue? In dystrophic calcification, the tissue is dead and tissue is degenerated. But on the contrary, in contrast to it, in metastatic calcification, the tissue is normal, live and healthy. Now, if you have seen this diagram, you will never forget the definition of the two types, the differences of the two types of calcification, dystrophic and metastatic. You can see clearly in the diagram, there is a difference in the tissue. Learn D for D. In dystrophic calcification, it is dead and degenerated tissue. In metastatic calcification, it is normal, healthy, living tissue. But what about the blood concentration or calcium metabolism in the blood? So in dystrophic calcification, since the tissue is dead, even normal levels of calcium can get deposited and cause calcification there. But in metastatic calcification, since the tissue is live, healthy, high levels of calcium is required in the blood to get deposited in the tissue. So this is the definition of the two types of calcification, dystrophic and metastatic. So let's discuss these types in detail. Let's discuss the pathogenesis of calcification in each of the type. So let's start dystrophic calcification. In dystrophic calcification, as I have told you, that calcification occurs in dead and degenerated tissue. Here, the level of calcium in the blood is normal. There is no hypercalcemia. Hypercalcemia is not a part here in dystrophic calcification. Calcification occurs in two phases, initiation and propagation. Initiation usually in most of the tissue occurs in mitochondria. That is intracellular initiation. Now, here in this flow chart, you can see the pathogenesis of dystrophic calcification. Why dystrophic calcification occurs? So, in dystrophic calcification, we know it occurs in dead and degenerated tissue. In dead and degenerated tissue, the cell membrane ruptures. The cell membrane of a cell just bursts, it ruptures. So, cell membrane contains phospholipid. Phospholipid is released. That phospholipid, there is an enzyme known as phosphatase. It will act, this enzyme is present in the cell membrane. So this phosphatase acts on the phospholipid and generates free phosphate ion. This free phosphate ion tends to attract the calcium from the blood. Calcium tends to bind bond with phosphate and form calcium phosphate, right? So if phosphate is present in any tissue, the calcium from the blood, it will leave the blood and get deposited in that tissue to form the bonds with the phosphate and to form calcium phosphate. So calcium binds with the phosphate ion and it will form calcium phosphate. That's why the calcium levels, even on being normal in the blood, they get deposited in dead and degenerated tissue. So here I would like to draw the diagram showing the same pathogenesis. So you can see here, I am drawing a dead and degenerated tissue. So these are the cells I'm drawing here. These are the cells of dead and degenerated tissue. So this tissue is dead and degenerated. When the tissue is dead and degenerated, the cell bursts and it liberates phospholipid. So here phospholipid will be liberated. Let me write here phospholipid is present. That phospholipid is acted upon by an enzyme phospholipase which is present in the cell membrane and because of which phosphate ions are generated. So these are the phosphate ions which are present inside this dead and degenerated tissue. Let me draw a blood vessel. This is a blood vessel supplying the blood to this organ. This is dead and degenerated. It contains calcium and calcium is in normal amount, normal concentration in the blood. There is no hypercalcemia. Now calcium tends to form bonds with the phosphate and because phosphate is present in dead and degenerated tissue, here the calcium will leave the blood and come here and get form the salts here. The salts are calcium phosphate, CaPO4. So calcium phosphates are formed. In this way, calcium get deposited in these dead and degenerated tissue. This is the pathogenesis. So what are the sites of dystrophic calcification? There are dead tissue, there are degenerated tissue. So can you enumerate some dead tissue? Can you enumerate some of the degenerated tissue? So here are the examples in front of you. So let me give you some examples of the dead tissue. In dead tissue, you can say it is caseous necrosis, like in tuberculosis. You can say dead parasites, sometimes present in human body. Fat necrosis, infarcts or coagulative necrosis, thrombi, hematoma. These are the examples of dead tissue. Now let me give you, so you can see in this diagram the necrosis. You can see the necrosis, the dead tissue in this diagram. The pink color you can appreciate here is all necrotic tissue. It is the dead tissue. Now let me give you some examples of degenerative tissue. In degenerative tissue, there is atherosclerosis. The best example is Monckeberg sclerosis. Monckeberg sclerosis is the dead tissue in the wall of the blood vessel, in the media of the blood vessel. Damaged heart walls, infected lymph nodes and degenerated tumors. These are the examples of degenerated tissue. So please learn few examples of dead tissue and few examples of degenerated tissue. In this diagram, you can see a blood vessel. This is the lumen of the blood vessel and this is the media. In the media, you can see this blue color, dark purple color deposition of the calcium salts here. This is known as Monckeberg sclerosis. So this is the same diagram, Monckeberg sclerosis. Appreciate these blue color. I'm marking here. Appreciate these blue color deposits. This is calcification. This is calcification, dystrophic calcification in the degenerated tissue. So these are the examples. So we are done with dystrophic calcification. We have understood the definition, pathogenesis and examples. Now let's start metastatic calcification. Again, I will tell you the first definition, then pathogenesis, then examples. So metastatic calcification. So we have already discussed the difference between dystrophic and metastatic. Here in metastatic calcification, deposition of calcium salt occur in tissue which are normal, live and healthy. Here tissue is not at all dead and degenerated. The tissue is live, normal, healthy tissue. But here the blood concentration of the calcium is more. That is, The patient is having hypercalcemia. Calcium metabolism in the blood is deranged. So this is the problem here. So it can occur throughout the body. That's why it is known as metastatic. It has nothing to do with the tumors, that is benign and malignant metastatic tumor. So it is a misnomer, you can say. Metastatic, the word here, metastatic calcification, means that it can occur throughout the body, in any part of the body, not only in dead and degenerated tissue. It is widespread. It can get deposited in any healthy, normal human tissue. So that's why it is known as metastatic. Now, let's discuss the pathogenesis of metastatic calcification. In the pathogenesis, you must understand in human body, there are some organs which lose acid. The best example is the gastric mucosa in the stomach. In the stomach, the gastric mucosa, the gastric lining, the parietal cells lose HCl, and HCl is secreted in the lumen of the stomach, but the parietal cells are secreting this acid. Whenever, and there are other organs also, I will give you the examples. So whenever any human part, human cell, human organ lose acid, so the underlying environment of the cell become alkaline. And alkaline environment, alkaline pH attracts the calcium for calcification. So calcium present in the blood will leave the blood and get deposited in such tissues, in such cells which have alkaline pH. Right. So here I would like to draw a diagram to show you the pathogenesis of metastatic calcification. Let me draw a tissue. Here the tissue, the cells of the tissue I am drawing, but these are normal, healthy tissue. These are not dead, these are not degenerated. It is normal, healthy tissue. This one is normal, healthy tissue, right? But the only thing here, the tissue is losing acid. It is losing acid. That's why the pH inside the cell is alkaline. It is alkaline pH. Inside all these cells, the pH is alkaline because it has lost acid. Now, let me draw a blood vessel. This is the blood vessel. Here, calcium is present in increased amount in the blood vessel. That is, the person is having hypercalcemia due to deranged calcium metabolism. That's why the calcium from the blood will leave the blood and it will get deposited here in the tissue and form here. Calcification will be there. This calcification is metastatic calcification. Here calcium loves alkaline pH. It loves alkaline environment. That's why it is leaving the blood and getting deposited in the tissue. This is the pathogenesis of metastatic calcification. Now, what are the sites? All the human organs which loses acid to some extent, or you can say all the human parts, human cells which have alkaline pH are predisposed of having metastatic calcification. You have understood the pathogenesis, the reason behind it. So the examples are basement membrane of the kidney, pulmonary veins, alveolar wall of the lung, cornea, interstitial tissue of gastric mucosa. I have already explained this. Synovium of the joint, systemic arteries and tendons. So these are the examples which have alkaline pH. That's why I have metastatic calcification. You can see here the basement membrane of the kidney. This is having the purple color, the deep blue color deposits. That is calcification. You can appreciate the same deposits here also. So what are the causes of deranged calcium metabolism which leads to hypercalcemia? There can be few causes. The most common cause is hyperparathyroidism. It can be due to neoplasm, that is primary, or it can be nutritional or renal failure, that is secondary. So hyperparathyroidism leads to hypercalcemia, or hypervitaminosis. Vitamin D is required for calcium absorption. So if there is more vitamin D in the blood, there is more calcium absorption. Hypervitaminosis D can lead to hypercalcemia. And there are some neoplasm like lymphosarcoma, apocrine adenocarcinoma that also secrete parathyroid hormone as a paraneoplastic syndrome, and that can also lead to hypercalcemia. So these are the causes of hypercalcemia in blood, that is deranged calcium metabolism. So the increased amount of calcium in the blood get deposited in healthy tissue which loses acid and which have alkaline pH. So these are the causes. So we have discussed the two types of calcification: dystrophic, metastatic, their definitions, their pathogenesis, their examples, their tissues in which they get deposited. Now coming on the gross and microscopy. Now gross and microscopy of both these types, whether it is dystrophic, whether it is metastatic, it is same. So let me discuss the gross first. So grossly, all calcification, whether it is dystrophic or metastatic, looks like chalky white areas. The word here is chalky white. Chalky white. If it is visible, it is chalky white areas. Sometimes it is invisible. If it is invisible, it can be felt. It can be felt as a gritty feeling. It is a gritty, hard feeling inside that tissue. It is same for dystrophic and metastatic calcification. So here in this diagram, you can see the heart walls. You can appreciate this chalky white deposit here. You can appreciate chalky white deposits here in the wall of the heart. You can appreciate the chalky white deposits in this tissue. You can appreciate the chalky white deposits here in this tissue also. So these all are chalky white gritty deposits grossly. Now coming on microscopy. In microscopy, the calcium appears, the calcification appears as deep basophilic blue color granules. On H&E stain, they appear as deep basophilic blue granules. Sometimes the calcium is deposited in the center and dead and necrotic tissue form concentric rings along it. It is known as pearl. It is known as pearl of calcium, or it is known as Samoma body. The special stain for calcium, there are few special stain for calcium. The special stain for calcium are two. You have to learn the names. It is von Cosa and alizarin red. Von Cosa give black color and alizarin red produce, as it is named, red stain. So there are two stains, von Cosa and alizarin red. Von Cosa gives black color, alizarin red gives red color to the calcium. And on H&E, calcium is deep blue granule, that is basophilic granule. Right. So in this diagram, you can see whatever deep blue color here, you can appreciate the deep blue color everywhere. So these deep blue basophilic deposits is calcification. You can appreciate. Here also you can appreciate this deep blue basophilic deposit is the calcification. Here also you can appreciate the deep blue basophilic deposit is calcification. This is the diagram of Samoma body or a pearl. In the center, there is deep blue deposition and it is forming concentric rings. This concentric ring of calcification, it is looking like a pearl. It is known as Samoma body. It is known as Samoma body. Samoma body is the pearl of the calcium. So this is Samoma body. Now, what is the significance and results of calcification, whether it is dystrophic or whether it is metastatic? Calcification is usually harmless, but the organ in which calcification is occurring, it hinders with the mobility of that organ and it causes inelasticity or rigidity in that organ. That is the only significance. Now, what we have learned in this video, what is the summary of this video? In this video, we have learned what is pathologic calcification or heterotrophic calcification. We have understood that calcium is normal in the bone and in the teeth. But apart from these two parts of human body, that is enamel of teeth and osteoid of bone, if calcium is deposited in any other organ of human body, it is abnormal and it is known as pathologic or heterotrophic calcification. There are two types of pathologic or heterotrophic calcification, dystrophic and metastatic. We have learned the differences between them. In dystrophic, D for D, the tissue, that the calcium get deposited in dead and degenerated tissue. But the calcium level in the blood is normal. The calcium metabolism in the blood is normal. On the contrary, in metastatic calcification, the calcium get deposited in healthy, living, live tissue, normal tissue. But here, the calcium levels in the blood are abnormal. There is hypercalcemia. The calcium metabolism is deranged here. So that is the two types we have learned. You can see here dystrophic calcification and metastatic calcification. Here it is dead and degenerated tissue. Here it is normal tissue. But in dystrophic, the calcium metabolism and calcium levels are normal. On the contrary, in metastatic calcification, the calcium metabolism is deranged, which leads to hypercalcemia. We have learned the examples. The dystrophic one is irreversible. The metastatic one is reversible if we correct the deranged calcium metabolism. We have learned the examples of dead and degenerated tissue. We have learned the examples, the sites where metastatic calcification is common. We have learned the pathogenesis of the two. This is the pathogenesis of dystrophic and this is the pathogenesis of metastatic calcification. You can see in dystrophic, the tissue is dead. So the cells are bursting. So cell membrane of a dead and degenerated tissue release phospholipid. Phospholipase enzyme is present in the membrane that act on the phospholipid and phosphate ions are formed. So dead and degenerated tissue contains phosphate ion which attracts calcium. Calcium form bonds with the phosphate and form calcium phosphate in the form of the deposits. That's why calcium is leaving the blood and coming here, getting deposited here. On the contrary, in metastatic calcification, all those organs which lose acid, So they have alkaline pH. They have underlying alkaline environment, alkaline pH, basic pH. The alkaline pH or environment attracts the calcium. So calcium will leave the blood and get deposited in the organ which is having alkaline pH. So all the organs in human body which have alkaline pH, which are normal, live, healthy, they are susceptible for metastatic calcification. That's all about pathologic calcification.